Good morning. It's like 7:30-ish. I'm walking over to the hospital. It's my first like real day of psych. We've had like 3 days of trainings and lectures. We had to learn verbal de-escalation tactics and like defensive move in case patients come at us, like hair grab or punch or kick or bite. So a little intense. I'm assigned to the ED today, so as what I'll be doing today and tomorrow. My shift is from 8 to about 4:30. Being a sponge essentially is my job. And that's cool. I can do that. All right, I'll check back later. Hello. So I'm walking back home. I thought today I was going to be in the emergency department, and turns out it was like ED/consult. But I get there, and obviously we have no idea what we're doing. It's like this group of 4 of us, and they start like taking us around the inpatient floor, and we're sitting there like, oh, is this what this is like? They go through like 20 minutes of taking us around, and then they're like, oh, just kidding, you're not doing inpatient, are you? Because we see another group of students coming towards us. I was like, this is not the emergency department. Where am I going? Everyone's looking at each other like, what are you doing? No, but we're doing this. Oh, but that's supposed to be you guys. Or I was on a consult service today. There was only one new patient, so we each like kind of broke up, like went seeing the patient, writing the note, creating a plan, doing the mental status exam and stuff. Got off just a little bit early. No complaints at all so far, actually. The patient today was admitted recently for alcohol withdrawal, and she was getting what's called delirium tremens, so seizures, tremors, right? Hallucinations and things. Anyway, I'm back home now. I'm gonna go to the gym because I have time today. Woo! And I'll study for couple hours after I get back, I think. And then we're back at it tomorrow. Same thing. ED/consult. Hello! Day 2. Feels so nice out here. So it's pretty much the same as yesterday. We saw a single patient being evaluated for capacity to like make their own medical decisions, right? And so pretty much every doctor is able to do that at like baseline, but if it's like specifically requested for, whatever reason, then they'll have psych and do that. And so it's more of like a full exam plus like certain questions to assess capacity tacked on as well. Really a learning experience. There were things like adult protective services involved and learning how they played into this, a little bit about what their role is and how they interact with the healthcare system. Yeah, I ran point on like the interview and stuff and writing the notes. That was really good to practice. Just like practicing writing notes. It's like, it seems like a really simple thing. Just like putting the whole story together in a cohesive way is actually a lot more difficult than it might sound. Oh, squirrels. I'll have the weekend off. Get back to it on Monday. I'll be actually in the ED on Monday. Oh my gosh, I almost forgot. Funny story. I'm gonna stop actually right here for a second. While I was interviewing the patient today, there were 2 other students with me, right? Because we were kind of tag teaming. Since we're all pretty new at this, it's helpful as long as the patient is okay with it, obviously. So I'm like asking questions, and part of psych exam, if you're a cardiologist, your physical exam is gonna be pulling out the stethoscope and listening. Well, the psych physical exam is the mental status exam. So one of the things I had to ask was, can you tell me where you are right now? Mind you, this guy, he's a little older. Wow, is that life flight? Oh yeah, helicopter. Sorry, it's kind of loud. He's pretty medicated, but still like, there and like talking to us, but he's pretty soft-spoken as well. So I had to like really lean in to like listen to what he was saying. Never listened so hard in my life. But at one point I asked him, do you know where you are right now? He goes, L. At least that's what I heard. And I'm like, L? And from there I just kind of moved on. I was like, okay, next question. And then I get out, and the other students, we go back, we start writing the note. We're talking about the mental status exam, and they go, oh yeah, it seemed like you didn't quite catch what he was saying. When you asked where he thought he was right then, he actually said hell. I was like, oh, I bet he expected me to like kind of chuckle at that, and I was totally deadpan. He was probably like, I just cracked a joke, lady, like take a joke. I feel so dumb. He was still cracking jokes after that, so I don't think he was too mad. Well, hopefully I'll have a nice weekend to catch up on some things and be ready to hit the ground running in the ED on Monday. All right, see ya. Jeez. Love everyone pops their hood. Here, take a look. Monday morning. I feel like it's gonna be a good day. I don't know. Woke up like early actually, like before my alarm, which is really weird. This is day 3 of psych. I'm actually gonna be in the ED today. I like being in the ED. Like, I don't mind it. I don't know how much I'll actually get to do. Maybe some interviewing, but they made it sound like not so much today, which is fine. Yeah, you kind of never know what you're gonna get in the ED, so I'm excited. Let's see what we're gonna see today. All right, hey, I just got back from the hospital. I'm gonna move actually really quick. It was really interesting. I had to see a bunch of different patients, people with bipolar, anorexia nervosa, like with a restricting type, major depressive disorder, borderline personality disorder, meth addiction and recovery, polysubstance abuse, like a whole array of things. Pretty cool. And even the resident that I was working with, amazing, by the way, the staff that I was working with, they even said at the end of the day, they're like, wow, you got a really full psych ED experience today. Definitely like a lot of detective work, a lot of puzzle piecing things together, looking at a lot of previous records. It was awesome seeing the resident and the attendees, especially the resident. I worked a lot with the resident today, and he was very good at talking and, you know, communicating in a way that didn't put people on edge, but made them like trust us more. So it was really cool to see that. Overall, great day. Didn't eat it all though. We were just like boom, 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 back and forth. Not too much pimping, a little bit, but like nothing bad. You guys ever feel like your brain goes numb? It's not necessarily tired. Your brain just goes, no more. We're taking a hiatus. And it's like, it just shuts down. I feel that a lot these days. And I did like 9 takes of this one stupid trying to explain this. So if that gives you any indication of where I'm at mentally today, numb. I'm trying not to be too neurotic about studying because I want to have a life during rotations. Now that I'm back for it today, I'll probably go to the gym, grab something to eat. Let's do it before I fall asleep. Good morning, last day on consults. Tomorrow I get to see ECT, electroconvulsive therapy, which, I mean, sounds like a scary name. And I'm like, who is in charge of PR for this? But it's extremely effective for like severe depression. I believe schizophrenia as well. So I'm really excited to see that tomorrow. The person that I get to work with here is one of only, I think, 3 people in the state that do this. Beautiful out right now. I feel good today, actually. I think it helps not having to go in until 8:30, 8:45 at like a reasonable, decent hour. A lot more relaxed pace on psych so far. So I am enjoying that a lot, I'll admit. But yeah, about to walk in, so I will check back later. Hi. I have to be kind of quiet because there are people in other rooms nearby, but I'm on partial right now. It's not fully inpatient and it's not fully outpatient either. It's in like an in-between thing for psychiatric patients who need a little bit more like structure and a little bit more intensive care and maybe training or therapy. Students just kind of like sit in on everything, and we get assigned one patient to go see and talk to and write up an H&P about. You know, we get our practice interviewing and writing up. A lot of it is just kind of listening, and I feel like everyone should do like some kind of rotation like this through psychiatric hospitals, outpatient centers, partial centers. It is so eye-opening. Why are psych services so underfunded? It is blowing my mind. Seriously, people who work here should be paid all the money in the world, and the patients that come here, like, don't get me wrong, like, they are really grateful for the services that are offered, but I know that there's also a lot more that can be done for them, right? It's just kind of like a lot of times it's lack of resources that allow, you know, people to get the type of quality care that they need. I was just talking to someone today who was like, yeah, I've been wanting to get this and this set up for, you know, treatment for me, but everywhere you call, it's usually like wait list. If you're lucky to get off the wait list and you get there, sometimes they're just like understaffed, or maybe funding just got cut for them, so they actually don't have some of the programs that you just like all this stuff. I'm like, why? Like, this stuff is everywhere. People everywhere deal with psychiatric issues, and I know I'm ranting right now, but it's just fresh in my mind at the moment. So I'm just, bottom line is, I think psychiatric services deserve way more time and funding than they currently get at most places. We need it to be more accessible. It's just incredibly frustrating to see how common of a complaint that is, that people can't get the care they need because their jobs and the support systems that are supposed to be around them are failing them, and then the care that they can access either doesn't quite cut for them, or it's too far, or it's just otherwise too big of a hassle or impossible for them to even get to. It's kind of just like, oh. Compared to my OB-GYN video during my the psych rotation, I've noticed that my energy levels are just generally lower. Like, it takes a lot out of me. It's not in a bad way. It's not like, oh, I'm bored. There is a lot going on and I feel woefully inadequate. I just get thinking and kind of like ruminating about like everything that I heard talking to patients. So I have to write up an H&P right now for a patient that I saw. So I have to hurry up and do that and eat my fruit. Ding. Oh, I almost forgot. So after lunch, guess what's going on? Pet therapy, baby. They're bringing in puppies. I'm so excited. They're like, are you okay with pets? I'm like, oh, of course I'm okay with pets. Yes. All right, check back soon. I just got out of our involuntary psychiatric facility over in Detroit, and we have 2 days here total. There's an adult section and an adolescent section. We just worked with the adolescents, deemed like a threat to themselves or others. It's pretty intense. I kind of probably look like a wreck right now. So half the time you're like doing activities with the kids. Like today, we went outside and played basketball, volleyball, and made bracelets for a little bit. But also, like, the other part of being here is sitting in on interviews. Here, their full psychiatric history. You know, kids like don't have, I feel like, as much of a filter, and so I'll tell you just everything. At least, you know, the ones that I saw. They did not hold back. These kids have experienced more trauma in their short lives than I probably ever will in the rest of my life combined. I'm sitting back there and I'm like, I feel like I don't even deserve to be here. I don't feel like I can relate enough to have earned the right to hear these stories, like to be here. I don't know if that makes any sense. You're probably like, what are you talking about? We have these white coats on, which helps staff distinguish us from patients. So we have to wear the white coats. I don't like wearing the white coat in general, but you like my new pins? Aren't they cute? Be kind, my planet. With rings and says love. What was I talking about? The white coat. Yeah, so we have to wear them. I mean, my first day here, and a kid turned to me kind of during an interview. She looks like she has it all together because, like, I mean, look at the white coat and like everything. Wow, or like life's so perfect, and here mine is. You know, and then the kid went on to explain, you know, all the things that have gone wrong with him. It's hard not to sit there and just kind of like shrink. I just want to shrivel up, not be seen anymore. And another thing about having the coats on is a little bit eerie. So you walk around and the patients, these kids, you can feel the eyeballs on you as you're walking around because they don't really distinguish between me being a student and like a doctor. They see me as someone who could possibly let them out of here. They want to get out. They're here involuntarily for the most part. Talk about getting out of your comfort zone in order to learn. This is like the epitome of that. Really amazing learning experience. The good part is a lot of these kids who come in here threaten to, you know, harm themselves or others can turn around. Like I was talking to the doctor and she's just like, when you're working with kids, if you can get them with, you know, developing coping skills earlier on, they turn around. They do better. So that is really heartening because hearing some of these stories, I'm like, oh my God. I really had to fight back some serious tears several times. I feel like everyone in the world should have a day at a place like this. Things that most people don't talk about, the things that like most people would rather shove under the rug, get talked about in places like this and worked through. I learned so much today. I'm gonna head home. I've got some studying to do, some Anki, some practice questions. All right, see ya. You guys, I am done with my OSCE. Oops, sorry, my keys are jingly. That went okay. Are there any schools that don't do OSCEs? I don't know if they're like going out of favor now that step 2 CS is a thing of the past, you know, they're not doing it anymore. I was really nervous for that. There are certain things that you like have to ask: suicidal ideation, homicidal ideation, substance use, if, you know, if they drink, how much, and they like get into specifics. Are there firearms that they have access to? Like those things are, if you don't ask those things, you pretty much fail automatically. You get 20 minutes of interviewing and then 15 minutes to chart, and then you move on to the next one. So there's two of those rounds. It's a time crunch. I actually thought I did better on this one, on the psych one, than I did the OB-GYN one. You get a piece of paper when you go in, and I like wrote out before walking in chief complaint, previous medical history, and like things I needed to ask related to that, and then like social history and things related to that, family history, and then the mental status exam, as well as like the psyche caps, so the depression screening questions, and like the dig fast for mania, and then like the differential diagnoses, and like help, like the pertinent positives and negatives, like hallucinations, manic symptoms, or like paranoia or delusions, things like that. That's just like important that you have to like put in each note and ask about. I didn't do this for OB-GYN. I started doing this for psych, and I think that was a big improvement for me, like to keep things organized in a form instead of just like, because on the OB-GYN one, like previous OSCEs, I would just like write down random stuff as I went along. And so when I went back to chart previous to doing this OSCE, like for the OB-GYN OSCE, everything was kind of scattered all over the place. That was dumb. Like thinking back, I definitely should have done this whole like formatting thing a lot sooner, but doing it for psych this round on these OSCEs was good. So for anyone who has OSCEs coming up, that's my recommendation, is to figure out a format. And if you have paper with you? I assume you would. I would write down before going into the room, if you can, the like outline of stuff that you want to ask about. That saved my butt today. So this last week of psych, I just have 1 day of inpatient, that's tomorrow. And then on Friday, we have the NBME shelf exam. Basically from now till Friday, I'll just be studying, doing practice questions. So just to clarify kind of study strategy, because a lot of people have DM'd me about, has my study strategy changed, psych versus OB, and like what do I do now for studying for the shelf? So what I do is at the beginning of each rotation, I do Anki and Amboss, right? Anki, there's X number of cards in the psych Anking step 2 day. So I look at the number that there are to go through and I divide them up so that I'm done with the Anki cards by a few days before the exam. And I pretty much do the same thing with the Amboss questions. I look at how many Amboss questions there are. Oh, you can see my grays. I look like a potato. Yeah, and I do the same thing for the Amboss questions. I look at the number of Amboss questions, divide them out so that I finish the Amboss questions a few days before. Why do I do this? Why do I not do questions all the way up to the exam? Because I want to finish the Amboss questions before so that I can have time to do NBME practice tests a few days beforehand. So at this point, several days before the exam, I have gotten all through my Anki cards and I've gone through all the Amboss questions for psych. Done. So now I'm just like reviewing Anki cards, not any new ones. And then I'm doing NBME practice tests and questions, which you can get for like $20 each. So it's like not too horrible. This was essentially my strategy for OB. OB turned out well. So that's what I'm doing for psych as well. I'm feeling pretty good about it. It's not super complicated. I like to keep things super simple. I need to get back in, run some errands, get on those NBME practice questions. I haven't done them today yet, so I should probably get going. Hi, I am on my way home from my last day of psych rotation in hospital bit. We did Jeopardy today with the M4s, going through, tougher topics. This always gets me the difference between like illness anxiety disorder versus somatic symptom disorder versus factitious disorder. There's these like families of drugs and different diseases that I get mixed up with really easily. So it was really good to go through those in kind of like a more fun way than just like straight up bonking. Almost home. I'm gonna go back in get some questions done, do what I gotta do. Hopefully take a little bit of time off later tonight. I feel like I can, relax, binge something. If you have any suggestions for what to binge, let me know. Anyway, all right, check back later. So I just spent the last 5 hours in Starbucks studying my booty off. That was a super productive afternoon. Hallelujah, because tomorrow's my test. So I'm glad that today wasn't a dud. And I realized I left something out when I was talking about my strategy for studying. A really important thing has been online med ed. I've found the psych ones fairly helpful. They're really concise, really, to the point, mostly high yield stuff. And to brush up on some of the psych pharmacology, because for me, it's really difficult to remember which atypical antipsychotics put you more at risk of metabolic syndrome, which ones are, may induce seizure. Differences in their side effect profiles, I find that really hard to keep straight. So I rewatched the sketchy farm videos. I take a break from my normal binging of whatever show, and instead I binged sketchy and online med ed today. Hopefully it was worth it. I'll find out tomorrow. Oop, gotta push the button. Wish me luck. All right, yes. Okay, so I took my shelf, officially done with psych. I think the way that I studied worked well without being overwhelming. So now let's finish off this video with the recap. People seem to like how I did, the recap at the end like I did for OB-GYN, so I'll do it for psych now too. Again, this is to give people who are interested in psych or are going to be doing their psych rotation soon a relatively quick bullet point summary of what to expect. So this recap will include a list of the different things that I got to do or see, how my expectations for the schedule and content of the rotation stacked up against reality, and a spitball description of the types of people that I found working in or heading for psychiatry, just based on what I've seen. This is mostly for funsies because I think it's hilarious to see the personalities in each specialty. Plus I'll have a couple of bonus miscellaneous thoughts sprinkled in at the end, so watch the end. All right, let's go. So what I got to do and see, really the only procedure that I saw on psych was electroconvulsive therapy. Definitely not the scary sounding thing that is portrayed in that one movie. Electrode, 6-second induced seizure. They're, I mean, obviously anesthetized and everything, so no pain. Anyway, that's that. That's the one procedure that I got to see. Other than ECT, most of what I did was interview. Lots and lots of talking, which honestly, no complaints really there. I mean, that's a skill that you just need to have in medicine, is just talking to patients. So it was great to actually get, especially as much time as you get in psych, because most of the other fields, you know, I've experienced so far and heard about, it's like you're in and you're out and it's really rushed. Psych, I was in there for like an hour with some people. All right, now as for conditions I got to see throughout this, you know, entire rotation, I'm just gonna read you off the list that I made of everything that I could possibly think of that I ran into or saw or consulted on. So here we go. This is all across all age groups, from literally like pediatrics, 12-year-olds to 90-year-old plus people. Lots of depression with or without psychotic symptoms, lots of anxiety, lots of suicidality, especially overdose and gun violence, some homicidality, luckily not a lot. Also active mania, bipolar 1, bipolar 2, panic attacks, catatonia. You're just unable to move normal, whether that means they're kind of moving repetitively, purposelessly in like random ways, or just literally not moving at all. Like you can move someone into a position and they'll just stay there. It's a result of like really usually severe psychiatric illness. So that can happen. It's like this really complex neuropsychiatric thing going on. Anyway, yeah, go Google it some more if you want more explanation. Also saw schizophrenia with like active delusions, tons of substance use disorder, alcohol, amphetamines, GHB, opioid, inhalants, nicotine, you name it. Eating disorders including anorexia nervosa, bulimia nervosa, neurocognitive disorders like autism spectrum, people experiencing active visual and auditory, not olfactory or tactile as much. Oh wait, no, I did see someone delirium tremens. When someone is going through really severe alcohol withdrawal, they can sometimes, not everybody, but some people get this really severe reaction. They can get tactile, like skin crawly hallucinations. And one of these hallucinations is actually what landed, it wasn't the hallucinations that landed this person in the hospital, it was the fact that they drove their car into a tree because the voices told them to. Driving the car into the tree and like breaking their leg was what brought them to the hospital. And then they figured out, oh, also they have some hallucinations going on. This was like secondary. You would think hallucinations would bring you in. No, in this case, it was like a broken leg. They're doing better now. Tons of PTSD, abuse, trauma across all, you know, socioeconomic status and age groups, personality disorders, especially a lot of borderline. I didn't come across narcissistic personality disorder specifically that I know of, or like antisocial. Saw some OCD, OCPD, lots of ADD, ADHD, and like bad side effects of psych medications that some people have. As far as the different environments that we were exposed to within psychiatry goes, we were able to see obviously inpatient in the hospital, saw both voluntary and involuntary, saw community outpatient in a couple of different ways, from like private practice to like a larger community center with lots of different services integrated in with psychiatric care, such as like legal, occupational support, and other types of therapies and, you know, things like that. More of a comprehensive center. We also did some time doing emergency department consults, and we got a day at the partial program they have here. I was able to sit on group therapy, individual therapy, supportive therapy, psychodynamic psychotherapy, which is like the Freudian, let's talk about your childhood, let's lay back on the couch. In fact, maybe what I'll do is, in honor of psych, I will do the rest of the video laying down. Let's see if I can make this work. In true psychiatry form, the classic lay on the couch, talk to the ceiling, and vent about your problems therapy. I think I actually will do this. I was kidding at first, but now it's kind of comfy, so I think I'm gonna stay here. I left off with psychodynamic. Oh, we also did DBT, so dialectical behavior therapy. If any of you seen She-Hulk, they talk about dialectical behavioral therapy in, I think, the first or second episode or something, and I thought that was hilarious, because it's normally used for borderline personality disorder, and then they try to use it to help teach She-Hulk how to Hulk, and I just found it really funny. Expectations versus reality of the rotations. I did not expect there to be so much writing. Maybe it was just because I was coming off of OB, where we did absolutely no writing, almost, except for like, you know, a couple of exceptions. So you write notes after seeing patients, which are longer because you're expected to go like pretty in detail and depth. So between those notes and like written reflection assignments that we were supposed to do after leaving the hospital, I did more writing in like 2 days on site than I did for the entire 5-week OB rotation. I thought the content and the conditions that we got to see were great, honestly. I mean, I listed off that entire huge long list. There's a lot of variety, which was fantastic. I just wish there wasn't so much writing. Oh my gosh, it was killing me by the end. Okay, I'm gonna sit back up actually, because I'm kind of getting a little toasty over there. All right, so expectations versus reality of the schedule. Honestly, about as I expected. Depending on the day, the earliest I would have to be in would be 7:15 for ECT. Usually I was there by 8, between 8 and 9, but then out by 3-ish most days. Like I was talking about earlier, those written assignments, like I would get off at, 2 or 3 or something, but then I'd have to go home and, spend an hour, maybe 2 doing written assignments. So it's kind of like I was out, but I wasn't off, Overall, though, schedule wasn't bad for me. Okay, now for the fun part, the kind of person that goes into psych. The good, quirky, stereotype, I'd say, is like 80% accurate. As for like the idea that psychiatrists or like people going into psych are basically, messed up people trying to solve their own problems, no. Nah. I don't know, from what I could tell, they were all like normal and actually super laid back. In particular, the residents. Most of the attendings too, to be fair. They did not try like intentionally to make our lives harder as students, with the exception of maybe some written assignments. Some of those I was like, do we need to do this? Maybe not. But most definitely there is a social advocacy streak in there, just by nature of like psychiatry being so at the cultural forefront of things, and also so integrated with the huge part is like biopsychosocial factors, the social determinants of health. Those play into psychiatric illness in a huge way. So it makes sense that there would be a lot of social activism going on within the psychiatry community. So is activism in that way is your thing, then psych might be good for you. Now some like miscellaneous thoughts here before we wrap up. I really, really, really appreciated the amount of autonomy that students were given in this rotation. Like we would get there on an inpatient day and they'd be like, okay, here's a patient that you can go see. Go see them, write the note, send it to me at the end of the day, and and then you can go. Like literally that's it. We would just do our thing. We weren't like micromanaged the whole time, which was so nice. I really thrive with that level of autonomy. Obviously it's nice to have, backup and resources. Like if I have questions, they're there, but it was really cool to have that level of independence as a fairly fresh like M3 still. And honestly, doing the things like interviewing and the note, writing up everything 100% on your own at first before like getting feedback later, most efficient way to learn, at least for me. Another miscellaneous thought, I did not anticipate how draining psych would be for me. I don't know if you all have noticed through, this video and like compared it to my OB-GYN video from last month or whenever that was. It's all a blur, but like I would get home most days and just crash and be completely useless for like an hour or 2. It was the weirdest thing. I felt so like mentally numb. The content is so interesting, but the problems that these people are dealing with are often so intense, and they'll just bare their soul to you and you just take it. And like a lot of trauma, a lot of the abuse, a lot of the really tough stuff that people deal with. I mean, that's what you're writing about and listening to all day. And to me, that was intensely draining. I actually talked to one of the residents about this and asked her, how does she handle this? When did it click for her that this was something that she could do long term? I cannot imagine myself ever doing this long term, just because of how drained I felt after every day, despite being interested in the material, because it is so widely applicable to every other medical specialty. You're always going to come across psych patients and psych meds. And what she said was she knew that she could do psych in part because she's able to compartmentalize in a way that helps her keep a healthy distance emotionally from people suffering mentally, but found that she couldn't do that as well with people that were suffering in more physical ways. Like someone breaks their leg, she had a harder time dealing with that and the pain that puts people through, and would come home drained after that kind of experience more so than psych patients. When she said that, I was like, oh wow, I am the complete opposite. Take that for what it's worth. I'm sure it's not like an applicable paradigm to everyone, but it clicked with me, made a lot of sense, and kind of helped explain why I was feeling the way I was feeling. And that is all I've got for this recap of my psychiatry rotation. If this bullet point style recap was helpful, let me know. Or if you'd rather just like hear the stories and stuff, let me know in the comments, DM me, whatever, so I can give people what they want for the upcoming rotation videos. If you enjoyed this video and want to see more like it, please let me know. Like the video, subscribe, all those things, and share it around with your, med school friends or family. My next rotation is neurology, which I'm super nervous about because I got wrecked by neuro in preclinicals. So anyway, thank you all so much for watching. Have an amazing rest of your day and catch you next time for the neuro recap.